Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest trends and interesting stories in healthcare technology. I'm here at the 2023 OntarioMD conference here in my hometown of Toronto, Ontario. It is a rare opportunity that I get to cover health IT in my home province, and I love it. What you're about to watch and listen to is my interview with Rob Fox, the CEO of OntarioMD. I wanted to chat with Rob about two very interesting things. One, I wanted to find out what his take was on the use of AI for physician practices here in our home province of Ontario. I also was curious to learn more about Rob's new initiative that he would like to get off the ground that will give physician practices a stronger voice when it comes to EMR pricing, EMR negotiation, and EMR enhancements here in the province. I hope you enjoy this interview. Rob, welcome to the program.
Thank you. Great to be here.
For the benefit of our audience, Rob, can you introduce yourself and tell us a little bit about what you do at OntarioMD?
Ah, well, thank you, Colin, for having me. I'm Rob Fox. I'm the Chief Executive Officer of OntarioMD. And our role is really to support Ontario Health in the rollout of their digital assets. We also have a mandate from the Ontario Medical Association to support physician practice optimization using technology. And OntarioMD ourselves are really focused on adding value to the healthcare system.
So, Rob, in your role, you touch and see and work with a lot of different technologies. We were talking before we got on camera here that AI, of course, is one of the technologies that everyone's talking about and everyone would love to deploy. Talk to me a little bit about your approach and maybe what you're going to be doing with AI.
It's really important to really take it back to why did we pick AI to focus on as a technology solution? And it really comes down to the value proposition the potential it has for physicians to reduce the administrative burden and burnout that is associated with that administrative burden for physicians. But the problem is that there are a number of AI solutions that have already been released, over 50 that are available to physicians now. The other problem is that there's a lot of rhetoric about the value proposition that AI provides. It saves X amount of hours per day in charting, or it smooths out a clinical process in one way or another. And the problem is we just hear this as anecdote. So what we're working on under a grant that we've proposed to the Ministry of Health and through Ontario Health is to do a detailed research-based rigorous evaluation of AI tools, what the value is that they provide, the clinical value, the operational and clinical workflow improvement that it provides, and potential improvements to the healthcare system in general. So that's something we're working on. We're also going to talk about how we can add more bots to this, how we can pilot it. So we're going to be piloting it with a number of organizations and physicians. And then how do we scale this across the province so all physicians can get access to this amazing technology?
So it sounds like, Rob, you're really trying to cut through the hype that may be surrounding AI, or maybe the euphoria that we're all experiencing with AI right at the moment. And you're trying to get to the real data, the evidence to say, hey, this is maybe where it can be deployed very well. Maybe this is an area that doesn't play very well. Is that kind of what you're doing?
And I think the focus right now is on AI scribe. So how does this ambient listening occur between a physician and a patient to create a more humanistic approach to the relationship, so they're not typing or writing and they can focus on the relationship. But that's still going to be a challenge because there's other AI solutions that are out there, and everyone talks about ChatGPT and other solutions. And so they get confused as to what ambient scribe and AI scribe does versus AI office automation or AI used in a hospital. So we really need to start really understanding the different components of AI and focus on what it can do to help a primary care physician now.
I like that because, as we were talking before, the scribe element of this is really going to take away one of the biggest complaints that docs have, which is sitting at a keyboard as opposed to looking at the patient and working with the patient. Is that your hope as well, that the ambient scribe is going to take that away?
Yeah, 100%. I mean, we always look at what's the problem we're trying to solve. And physicians can spend hours a day after they've seen their patients really catching up on those notes. And how do we make that process easier for them? I've already heard anecdote from physicians that are in downtown Toronto, saves them over 2 hours a day in documentation. And they say, you will never take this AI scribe solution away from me, ever. So it's getting that much attention. It's a very hot and sexy topic for people right now. So how do we make sure that we are responsible in our approach and really evaluating things like privacy and security? How do we make sure that the physicians are protected in terms of adopting these type of solutions?
Yeah, because that's very key. I think a lot of people right now are maybe experimenting with ChatGPT to do things like letters and communications with patients, which I think is fine. But as we both know, that's a public generative AI tool. You probably don't want, and you definitely don't want to put any sort of patient information into that. And so it'll be interesting to see how maybe you and others can use AI and generate a very safe and affordable way for people to adopt.
Of course. I mean, cyber security and privacy are essential in all solutions. Secure messaging, AI, even billing. So how do we make sure that we protect ourselves? But you're right. AI is really an area of focus, a sensitive area, because we're creating the foundation for how AI is built. So we want to make sure we are rigorous in our evaluation and are thorough to protect everybody.
Let's talk about EMRs for a moment. I mean, OntarioMD, back in the day, it was known for helping docs choose and sort of establish a floor of functionality and capabilities for EMRs, because there were so many of them back in those days. Where are you taking EMRs now, or where are some of the things that you're working on in that space?
Right. So it's a great question, because I actually worked at TELUS Health, that was one of the providers of one of the big EMRs in the province. And having come to OntarioMD, my focus is around integration of EMR with the hospitals and with other providers in the community. So how do we really push that agenda of sharing primary care information in an appropriate way to help the healthcare system care for patients better? So I think that's a really important question. But there's a problem out there, and there's always a problem to solve. And the problem that I want to solve around EMRs is some of the frustration that the physicians have on quality, on price, on random price increases, on restrictions on migration, and a number of other challenges. So it really is, how do we work with the EMR vendors to perhaps look at a new way of contracting services between the physicians of Ontario and the EMR vendors themselves?
And can you give us a little hint of what that might look like in terms of, are you talking about getting a bigger voice, and so to talk more about enhancements they want, or are you talking literally about contract negotiations and things like that?
I'm actually literally talking about a concept where OntarioMD or a partner of OntarioMD would centrally broker and negotiate the contracts on behalf of all of the physicians in Ontario with the EMR vendors. So we have a centralized voice, we have more negotiation potential, and I believe it'll provide more longer-term value for the EMR vendors with longer-term contracts. It'll have one centralized group to negotiate with and to do billing with, so that'll be a benefit for the EMR vendors. And I think it'll also be a benefit for the province in terms of having leverage and negotiation capability at a higher level with EMR vendors on behalf of data sharing or other ministry projects.
It sounds like that one of the benefits of this potential grouping would be a stronger voice for enhancements and for new features that maybe are specific to Ontario doctors that may not have gotten the attention when it was just one doc asking for it, but when a larger group does, I would imagine that the EMR companies would now have to listen.
Right. And so OntarioMD, or a partner of ours, could be that group that collates all of those requests, puts them into different categories, and also puts a roadmap or a plan together on how each of those requests can be addressed. I was at a meeting last week, and one of the clinics articulated a frustration with how information is collected in the EMR. And it just didn't make sense, but hadn't been listened to in terms of the change. And so that's an example of how we could come together and say, okay, these are the problems. This is how we're going to work on it with the EMR vendors. So they're also not inundated with one-off requests, and it goes to the group that actually can do something about it. So coordination, categorization, and prioritization, I think, would be the key to that.
Rob, a lot of the other media mainstream media has been talking about some of the problems that are in healthcare. And there's been a lot of negativity in terms of the coverage. Let's talk about some of the positive stuff. What gets you excited when you look at what's happening in healthcare? Where are the pockets of innovation or of improvements that are kind of you look to and go, hey, that's the good news side that needs to be told?
Well, I mean, that's what gets me up in the morning is what's new today. Like almost every day, something new comes to me. And at our conference here today, there's some fantastic vendors that are showing things like AI automation for office practice. So how do you use AI to automate what would take long time or need a lot of people to do now can be done in an automated fashion. I mean, that's at the base perspective. I see the system really coming together. So acute care and primary care are really coming together in terms of bidirectional sharing of data and information. And once that happens, you can use the information in aggregate to figure out opportunities around population health, around performance excellence of the system, and how we can take the system to the next level. So that's kind of at that level. And then how do we take that nationally? Once we have pockets of excellence and people have demonstrated value, how do we scale that? And that's one of the frustrations I have is that somebody might do some fantastic work and others don't know about it. And why can't we copy or rinse and repeat these great opportunities in other areas? And so I think there's more sharing, more coming together at the provincial and national level. I mean, there's also examples internationally of great work that's going on in tech integration and automation and use of data and population health strategies. So most of those are driven by technology. So it's our responsibility to make sure that we have that integration and we optimize the system's functionality that we have.
Amazing. Rob, you shared a lot of great information with us today. Where can people go to find out more about OntarioMD?
Well, please go to our website, OntarioMD.com. And you could also reach out directly to our main line through our website. And please give us your opinion. We want to hear from you. We want to hear about what should be our priority. We represent the physicians. We represent the care that they provide and optimizing that. So how can we do it better? We want to hear from you.
Rob, thank you so much for being on our program today. Really appreciate your time.
Thanks, Colin. It's fantastic. Great time.
I want to thank Rob for spending time with us today and for coming on camera to talk about OntarioMD. I really appreciated the insight he gave into the AI study that they're going to be doing to really dig down deep to find out where AI can be practically deployed for physicians in Ontario. I also appreciated Rob's very candid take on where he would like to give physicians here in the province more of a strong voice when it comes to EMR and specifically EMR negotiation around pricing. I hope that initiative gets off the ground and that Ontario doctors will benefit. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to healthcareittoday.com where you'll find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.